Hi everybody, I'm Dr. Alex Pastuszak and I'm a urologist at the University of Utah who specializes in male reproductive and sexual health. Let's talk for a minute about vasectomy reversals. So about 5% of men in the United States decide to have their vasectomies reversed every year. Currently, the only way to do this is surgically through a vasectomy reversal, which should be done only by a specially trained urologist who does these surgeries regularly. So there are two quote-unquote flavors of vasectomy reversal, which include a vasovasostomy, or VV, and an epididymal vasostomy, which I know is a mouthful, also abbreviated in EV. During a VV, the two ends of the vas deferens are sewn back together, whereas during an EV, the part of the vas deferens coming from your testicle through the abdomen is sewn directly to the epididymis, which is part of the testicle that stores sperm. So the decision to perform either a VV or an EV can only be made in the operating room, and while both a VV and an EV are technically challenging cases, most of us consider an EV more technically challenging than a VV because you're sewing a 2 to 3 millimeter opening in the vas deferens to a half to 1 millimeter opening in an epididymal tubule. Furthermore, we use sutures that are finer than a human hair to do this and work the entire time under a microscope for best results. So how successful are these procedures? After a VV, about 95% of men will have sperm in their ejaculate after the procedure, and about 75% of couples will be able to conceive naturally. In contrast, after an EV, about 75% of men will have sperm in their ejaculate, and only about 50% of couples will be able to conceive naturally. Most reproductive urologists who do these procedures will tell you that in most cases, couples should consider vasectomy reversal and natural conception before they consider IVF, in part because it's cheaper, but there's also some evidence that it's safer for the child, as some forms of IVF can slightly increase the risk of birth defects and nervous system disorders. So that's our crash course on vasectomy reversals. If you're thinking about having another child after you've had a vasectomy, come visit with us at Utah Men's Health at the University of Utah.